Okay, let's start my presentation. And good afternoon, everyone. Very nice to meet you. My name is Zihao Zhao. I am currently a last year PhD student from the University of Science and Technology of China. In short, we call it USDC. And I'm very pleased to present our latest work, which is titled Leave No Patient Behind, Enhancing Medication Recommendation for Rare Disease Patients. And my presentation will be in 4 parts. In the first, I will introduce the background, which includes the task and the fairness issue in this task, and I will introduce some difficulties. Later, I will introduce our proposed method, which is called RareMed, and after that, I will introduce our experiment result, and I will conclude our presentation. So in the first, the medication recommendation, this is a very important direction of electronic healthcare, intelligent healthcare. The model input typically include 2 sides of information. On the first side is the patient clinical condition, such as the condition extracted from the electronic health records, EHR system, such as the diseases, the procedures, and the history of illness. And the other hand is the medication information, such as the molecular sequence, the substructure, and the drug-drug interactions. And the model input is the medication combination prediction, and we expect it to be effective and safe for the patients. By developing medication recommendation system, we hope to reduce the doctor's workload, to minimize the medication errors, and to address the healthcare disparities. However, the existing methods faces serious fairness issue. Let's first look at the data distribution of disease codes. Here we present the distribution of disease codes in 2 popular EHR datasets called M2.3 and M2.4. As we can see here, that the rare diseases, which is in the long tail, they are often underrepresented in the tail distribution. So from the representation learning perspective, there is a huge challenge because it is very difficult to capture the accurate profile for those uncommon conditions. So as a result, we can see that for some state-of-the-art methods in this area, they often provide a much more accurate medication recommendation result for patients with common diseases than those with rare diseases. So this is a huge challenge, and it raises concerns of the equality and fairness, and also undermines the reliability and utility of such systems. So it's very important to solve this fairness issue. However, when we try to promote the equality of such system, we face some difficulty. The first difficulty is the data scarcity. As we mentioned before, the model is very struggle to learn robust representations for rare conditions. So we need to develop more sophisticated strategies to enhance the data utilization and representation learning. And the second difficulty is that the rare disease patients often have more complex clinical condition. As we shown in the figure 3, we see that patients with rare disease, which is on the left side of the figure, they have more disease counts, which means they have more complex conditional profile. We can also observe a similar pattern of on the medical procedure. So there is a more complex association between diseases and procedures for rare disease patients. So we need more sophisticated AI approaches for these patients. And the third difficulty is the tailored medication needs. Similarly, we can observe that the rare disease patients, they need more number of drugs. In other words, they require more personalized and complex medication plans. So we need a better encoder to capture those patients' clinical condition. And next, I will introduce our method, which is called RareMed. The RareMed, the name comes from the robust and accurate recommendations for medication. This is an overview of our method. In our method, we introduce additional embedding layers, which is on the bottom of the figure, and we introduce the pre-trained fine-tuned learning paradigm. We also introduce 2 self-supervised pre-training tasks. So ultimately, we promote the accuracy and fairness of the medication recommendation systems. So in detail, the first part of our method is the patient representation module. Traditionally, methods treat the disease sequences and the procedure sequences separately, but that is not enough to capture the complex profile of such patients, as we mentioned before. So in our work, we put those in a unified sequence, and we add 2 additional tokens, CLS token and separate token. And we also design 3 specific embedding layer. The first is called token embedding, where we assign unique identifier to each disease and procedure code, the first embedding layer. And the second embedding layer is called relevance embedding. In this embedding layer, we rank all the medical codes according to their importance to this patient. And so this embedding layer helps to rank the significance of medical events. And the third one is the segment embedding, which helps to distinguish which code belongs to the disease sequence or the procedure sequence. And after that, we will introduce the patient representation to a transformer encoder, and we use the output representation of the CLS token as the patient representation. After that, we will introduce 2 pre-training tasks, which is called self-reconstruction, where we reconstruct the input clinical code sequence from the modeled patient representation. And the second is the sequence matching prediction, which discern whether the disease and procedure sequences belong to the same patient or not. After the pre-training of our model, we will fine-tune our method on the medication recommendation task to provide accurate medication recommendation. During inference, we will predict the probability of each medication, and we adopt those greater than the threshold to be included in the medication set. And I will introduce our experiment result. First is our experiment setting. We use 2 main data set, which is called MIMIC3 and MIMIC4. They are all famous public EHR data set. And we use the state-of-the-art baseline on this task. First, the overall performance in this table shows that our method achieved the SOTA accuracy and safety on this task. And more importantly, our method also solved the fairness issue. Specifically, we divide all patients into 5 groups according to their disease popularity. The first group is the patients with the commonest diseases, and the last group is those with the rarest diseases. as we can see that our method achieved similar accuracy across all groups. However, the baseline methods also often their methods drops as the disease popularity decreases. After that, we also dive into the effectiveness of our pre-training pre-training technique. We can see that as the pre-training epochs increase, our method, our accuracy on different groups typically increase. So this demonstrates the effectiveness of the pre-training technique. So to conclude, our work identified the unfairness issue in medication recommendation task, and we introduced our method RealMed to employ a pre-training technique to learn robust representation for patients, especially with rare diseases, and enhance the recommendation accuracy and fairness. We conducted comprehensive experiments on benchmark datasets, shows that our method outperforms existing methods. After the end of my presentation, I want to express my acknowledgement to our team. And if you have any other question, please feel free to contact me by email. Thank you very much.